This brief video provides an overview and summary of the impact of the COVID-19 pandemic on neonatal care, based on reflective narratives from staff. When watching the video, think about the implications that this situation has had for the nursing care of babies and families. At the start of the pandemic, the most striking impact of restrictions on both visiting and social contact was the barrier to family involvement that went against the principles of family integrated care that lie at the heart of neonatal nursing. Fathers or partners had not been able to fully participate in the pregnancy experience, and even in the hours and days after the birth of their babies, restrictions were still in place. This, combined with the challenges of wearing personal protective equipment, or PPE, meant that neonatal staff were faced with a situation they had never faced before. Much was unknown about this new virus. It was clear it was easily transmitted by both contact and through airborne routes. Swabbing and testing became commonplace. Fear and uncertainty around swab results and the ramifications leading to potential isolation, if positive, or when waiting for the results, impacted on both staffing and contact with others. Maternity and neonatal staff were faced with implementing changes to visiting policies, even though we absolutely know that parents are not visitors. However, this led to additional barriers to the usual separation that occurs when a baby is admitted to the neonatal unit, impacting on the development of family integration into care. The wearing of PPE by both staff and parents became commonplace. In addition, in many cases, both parents were unable to visit at the same time, which led to further separation and isolation. Communication, which is so important in neonatal care, certainly became more challenging. Trying to connect on a human level to comfort parents was made more difficult by masks and distancing. It was therefore absolutely vital to continue to strive to care compassionately and sensitively and to give support, regardless of these restrictions. Therefore, it was essential to keep the communication channels open, vital due to the barriers imposed by masks and the potential impact they had on connecting parents with their babies. Connection was even more difficult for families with other children, and the need for mobile phones and remote communication was never more vital, particularly when parents and families were unable to come to visit their baby in the unit together. Video technology also became essential as a way to connect families together and to provide a way for parents who were unable to visit, a way to see their baby and for them to feel closer to them. Reaching out to support parents at home also presented a new challenge, due to the community health professionals not being able to visit people's homes. Once again, mobile and digital means of communication were never more important than they were now. It was also important to be mindful of the impact of self-isolation, not only for staff who may have symptoms or waiting results of swabs, but also for parents with babies after discharge home. Being at home with a baby born prematurely or who has been on the neonatal unit for some time can be isolating enough, but this was another factor to consider. Above all, we've realised how vital it is to continue to support each other, staff, parents and families alike. Knowledge about the pandemic is rapidly changing, with regular news updates on a daily basis, guidance also changing to affect our lives. We don't know yet what the long-term impact will be of this pandemic on us and families, but we do know how vital it is to stay connected with each other. We've all had to get used to new areas of practice, which have affected the ways that we work and how we interact. It's also important to emphasise, again, that parents are not visitors, they are an integral part of their baby's care, and how every effort must be made to keep parents connected to their babies. in line with the principle of zero separation. Finally, it's worth emphasising the importance of working together as a team and staying connected with each other. Here are a selection of resources relating to the COVID-19 pandemic and the care of babies and families in the neonatal setting. Thank you for listening to this presentation relating to neonatal nursing in a global pandemic. With thanks to Joel Cooper for the illustrations and to the Hertfordshire Community Nurses Charity for funding this project.